that exists here at the highest levels of government, the #2 leader in the United States Senate, the president's top advisor. I can't really think of many other issues where you're going to hear them talking in so many consistent themes and so much support for a national initiative. It's just very exciting to be working in this area. And again, I think it speaks to just the kind of support that everybody in this room has and how excited people are to be a part of this. So we're going to now introduce our next panel. I think we're going to try to make this a little more comfortable here. We're really getting into the mental health theme. We're sitting in chairs now and talking to each other in comfortable environment. We're going to get, I think, folks here mic'd up. Let me just give you a little bit of background on what we're going to try to do here. You'll recall Dr. Fabello talking yesterday about the actual scale that these initiatives need to be on in order to have an impact. And I think some of the things that a lot of people have been talking about is just how many people need to be served in order to actually have an impact on the overall prevalence of the mental illness in jail. And I know that the next question that everybody asks is, how are we going to pay for this? Where's the money going to come from to do this? And I know that there is no expression that frustrates service providers more than what we're going to do is we're going to leverage existing resources, right? We're going to better connect people to what's already out there, and we're going to make use of all the things that are already in place, and just by better coordination, we can do a lot more. And there's a lot of truth to that. There's certainly a lot of truth also to getting better outcomes for what we're currently spending. But at the end of the day, I think everyone here is quick to recognize that there is not enough capacity in the community to do all the things that we're talking about. That's going to have to be increased. That's going to take resources. Where is the money going to come from? It certainly isn't going to come from all of the counties in this room. We know how stretched your budgets already are. It has to come from other places. And as you know, every time you turn and look to somebody else, they'll tell you, why are you looking at me? Why aren't you leveraging existing resources and coordinating with people in your community? So that's the vicious circle we're in, and our panelists know that we're going to be taking those questions to them. Let me introduce you to them. First, Tracy Plouck, who's just to my immediate left here. Tracy is the director of the Ohio Department of Health and Mental Health and Addiction Services. She has been in that capacity since 2011. If any of you have heard Governor Kasich talk about mental health and substance abuse issues, you can hear his really deep commitment to this particular topic. Before that, she was the director twice of the state Medicaid agency, so she gets all these complicated funding streams. Incredibly well respected nationally. She's the president of the National Association of State Mental Health Program Directors. Next to her is Dr. Andy Keller. Dr. Keller is a psychologist who has been working on mental health issues for well over 20 years. He is the president and the CEO of the Meadows Mental Health Policy Institute. And many of you may not know what that is, but if you're in Texas, you know that that's actually quite a big deal. That is an institute founded by the Meadows Foundation, which focuses on Texas, and really is key to bringing together philanthropic institutes with the private sector, and they have a whole initiative focused on this particular topic. Next to him is Secretary John Wetzel. Secretary Wetzel is the head of the Pennsylvania Department of Corrections. Pennsylvania Department of Corrections is a big corrections agency. About 50,000, Secretary, inmates on any given day incarcerated in the Pennsylvania system. That, of course, does not speak to all the county jails in that system, and Secretary Wetzel will be the first to tell you that the counties are where it's at. I know he'll give a big shout out to his base in Franklin County, where he came from and worked in the Franklin County Jail as a career corrections professional, although if you follow him on Twitter, what you'll notice is he likes to talk more about his background as a college football coach. So Secretary Wetzel, good to have you here. And then next to him is Maury Thompson, who's the Assistant County Manager in Johnson County, Kansas. Thrilled to have Johnson County here with us, doing a lot of great work. They hosted a Stepping Up event. They helped kick off the overall initiative. And Mr. Thompson's going to be talking about really how federal grants, which you're going to hear more about, can play an important catalyzing role in this, and then also how the counties need to coordinate with municipalities. So you have here philanthropy, state and federal funding streams from the justice and health side, as well as local government. We're going to be asking these folks, where will the money come from? And I think we should have an interesting interactive discussion. So let me start with you, Director Plouck. I know that for many in the room, everybody keeps hearing about Medicaid, and then people instantly think, God, it's so complicated, it's paralyzing the topic, and then people think, well, I'm an expansion state or I'm not an expansion state, and you know, what's just the overview that many, I think, of the elected officials who really aren't experts in this area need to know about Medicaid and how it's relevant to this particular topic?
Michael said, I've been the mental health commissioner in Ohio for about 5.5 years, and I joke that I spend most of my time asking people for money and having people ask me for money. So it's kind of ironic that I'm here on a financing panel today. But I think that before you really start thinking about financing, you really have to identify what specifically it is that you want to prioritize and move forward. You had an excellent document yesterday that outlines the 6 criteria. I talk a lot in Ohio about how we're not going to see $100 million fall out of the sky for this purpose. And so what specifically do you want to move forward first and focus on that? And funding sources may vary depending on what your initial objective is. So certainly identify that, and then identify the team that's going to help make an ask of someone, because I think the leveraging comment is very true. This will require additional resources, and the question is how to identify and obtain those additional resources. For services, you've got, in my mind, sort of 3 buckets. You've got diversion-related services, institutional, incarcerate-based services, and then services and supports that are available post-release. And the financing for those settings and for those approaches varies as well. Medicaid can be a payer of some clinical services in the community, but not in the institutional setting. Supports that might be peer support, employment support that you might want to connect an individual with post-release. Oftentimes those are not funded by Medicaid and would need some other types of resources. And so really identifying what it is you want to do will help you guide the path. Thinking about services though, whether you are a Medicaid expansion state or not really is the first fork in the road. And Ohio, we are fortunate that we did indeed expand Medicaid. Since January of 2014, we've had 398,000 additional individuals connect with either mental health or addiction treatment or both. So I think that's fantastic. Many of these individuals have been involved with criminal justice. And so one thing that we try to focus on is how to get people signed up and actually linked in with Medicaid. And the jail is an excellent intervention point. So think about working with your Medicaid department and go as a team. Bring the sheriff, bring the county commissioners association, relevant state agencies. We're actually meeting with all the mental health commissioners later this week to talk about how we would really like to see the commissioners partner with communities that are here and other communities that are interested in this topic. But Medicaid can actually provide some good technical assistance regardless of whether or not you are an expansion state. To the extent that you want to offer clinical services, whether it is, access to psychiatry, access to assessment, counseling, etc., knowing what is available and for whom it's available varies by state. And so having that detailed discussion and really understanding what their parameters are and also to what degree they are open to thinking about some creative options that may not be in existence today but might provide overall benefit as far as improved outcomes for individuals, that is absolutely a key conversation to have. And to the extent that you have any advocates within the governor's office or elsewhere in the administration, they would be great folks to fold into the conversation as well, because it really helps to demonstrate the collaborative spirit. For state dollars then that are unrelated to Medicaid, you really need to try to find a champion or a series of champions, whether it's in the legislative branch or the executive branch. Back in 2013, we consolidated our Department of Mental Health and our Department of Addiction Services into a single state agency. And I've been having conversations with the Buckeye State Sheriff's Association and the County Commissioners Association about how challenges related to the stepping up theme are prominent across Ohio and they play out in different ways. So when we consolidated the departments, we identified $1.5 million in administrative savings that was going to occur. Rather than let that lapse to the general fund, we made the case to the governor and the General Assembly to actually invest that in intervention services supports at the county jail. And that was not a panacea. $1.5 million doesn't go very far when you have 11.4 million people in your state, but it was a show of goodwill, and it helped to build out some initial partnerships in some communities where they had the will, but they didn't have 2 nickels to rub together to get something started. So just that little bit of resource helped. We doubled that for this biennium, and I look to see that grow in the future. So these grants are, average about $150,000. We're not talking about much, but it's enough to kind of get some conversation started, get some initial services in place, and think about how you can tie Medicaid and how to tie some other sources, funding sources, to those resources to really, help build a corpus that can be moved forward to enact some change. You demonstrate progress, and then you go back to the General Assembly, to the executive, and say, look at what we've accomplished, we want to build out on this. And that's been our strategy. Again, we're sort of in the initial stages, but I think that there's some benefit there. We also are constantly on the lookout for other resources that we can devote to this purpose. I have at my discretion $3 million this year for some hospital diversion activities in the community. And looking at the data in southwestern Ohio, or southeastern Ohio, we have Appalachian counties. We knew that 10% of our 10% of our hospital admissions to our state hospital were coming from the jails. Why is that? There are no services and supports in some of these very rural jails. So by making an investment in the jail for treatment services with these state general funds dollars, we're hoping to make the case that we will see fewer people have to be transitioned to the state hospital because they're in crisis. And as a result, we will use that to make the case to expand that kind of approach in other rural areas as well. So really thinking about, at every opportunity, how can I apply this to the stepping up concept? How can I apply different little bits of funding to help build out not only goodwill, but then some things that are going to take you further down the road with the 6 criteria. There are block grants that states administer both for mental health and for substance use disorder. I will tell you that the substance use disorder resources are much more robust than the mental health block grant resources. So here is an opportunity to think about people who are dually diagnosed. And are there some resources that you could bring to bear through the block grant, not in the institutional setting, but as part of a diversion program or part of a post-release program that would help folks to reduce recidivism rates in the communities. So that's another option, again, kind of thinking creatively about how the current state's use of the block grant might be somewhat modified in order to be attentive to this particular challenge.
Director, I'm sorry, I'm just going to interrupt and then bring it over
Sure.
to Secretary Wetzel. But before I do, just so much great information that you're providing. There's going to be a follow-up breakout session on this afterwards. But just for key take-home points, what I'm hearing you say is, number one, set up an appointment with the state Medicaid office and talk about whether you're an expansion state or not, and start talking about how to increase enrollment rates of people who are eligible. And second, talk about technical assistance to determine what actual expenses could be actually billed to Medicaid. And then secondly, an appointment with your state mental health and alcohol substance abuse director, sometimes the same agency, sometimes 2 different agencies. Talk about discretionary dollars that may be available just to begin getting a little momentum going. And then secondly, look at that substance abuse block grant. Are those fair takeaways then for everybody here? So we have some action items there, right? Potential funding things to look at and how to start conversations with our partners in state government. Let's now go over to the State Secretary of Corrections and see what he has to offer. And I know that we hear so much Secretary, you hear this from the legislators or other advocates, and they'll say, listen, there's 100 fewer people now in your system, and if I do the math, that's 100 times 40,000, so I just saved you a whole bunch of money. So now take that money and invest it in me. How's that argument going to work for the county folks out there?
Yeah, I hear that a lot, and I'm sure my colleagues hear that a lot, and as we all know, it simply just doesn't work that way. But I think from your perspective, and as Mike pointed out, I spent the vast majority of my career, 21 of my 26 years, working in counties, both Franklin and Berks County, who's here, where I was a correctional officer back in the day. And I got to tell you, the key from my perspective now, what you have to understand with people like me, is that my primary interest is self-interest. So if what you're doing, I can't draw a line to how it's going to benefit me, then I'm uninclined to invest. And I think Al Bloomstein talks about the criminal justice funnel, right? More people come in the front of the system, they go to jail, and less people come through the system. And so as I look at local systems, they're one of 2 things. They're either a feeder or a filter. And I think the argument you make is the filter argument, that you have the opportunity with a smart investment, and frankly, my budget at the county was probably $5 million-ish, something like that. My budget now is $2.3 billion. At the county, if we purchased a shirt, I signed off on it. Now, if it's less than $50,000, I don't even see it, okay? Just to give you some perspective. So what to me is a relatively small investment, if I can envision a path that it will ultimately benefit me. makes sense. And I'll give you a real finite, for instance, is something we're working with the Council of State Government's Justice Center. We tried to find a county to really get a good grasp around the what as it relates to criminal justice and mental illness. Because every room I'm in, this is the primary topic, from district attorneys to advocates to lawmakers. But when you start getting into specifics, we don't even really know what we're talking about because we don't do a good job of quantifying it. We don't understand it. So if you can't understand the what, you can't get to the how. So we really, as a state, and my colleague, the Secretary of Department of Human Services, and I partnered to try to identify a county that was scalable. So in Pennsylvania, we have Philadelphia, which is scalable to nothing, and every other county hates them. So we never start anything there. So you take Philly out of the mix. There's a couple other reasons too, but we're in public, so I won't discuss them. Love you, Philly. But so try to find a county that is somewhat representative of the other counties, and more importantly, that we can learn lessons and scale it statewide. So we identified Dauphin County, right in the center part of the state, to really do a deep dive in this data and do it in a manner where the state can build an infrastructure that we can aid other counties and do that. Now, the other context that you have to understand at the state level is that long-term thinking in state government is the next election. So 2/3 of everybody who's in Harrisburg, that means 2 years, all right? So when you talk about return on investment, if you're coming to me with a program that results in cost avoidance 8 years from now, don't bother. Don't bother. So if we can see a finite path and you have the ability to be a filter, and we have the ability to scale that so the filter becomes larger and less people ultimately come to me or to the state hospital beds, that makes sense. And I think in this context, and I'll tell you, in my role as an executive member of the State Corrections Administrators, this is an important initiative to us too. So I would encourage you to talk to your state prison director. And certainly, if they're not available, you can reach out through me and I can put you in touch with them. I think it's an important conversation. And I think we, the corrections directors, may be your biggest advocate in this area.
So we've just heard an approach, right, to some of our health state officials, and then we just heard an approach to our state corrections administrators. Can your county be a demonstration site for all counties across the state and really show how something can be done, be that filter that other counties can emulate? So thank you, Secretary Wetzel. So now let's go to philanthropy. Dr. Keller, I know that you're, again, affiliated with the Meadows Foundation, engaging a bunch of other foundations. Talk to us a little bit about how that's playing out in Texas.
Sure. Thanks. Apologize for my very mellifluous voice this morning. Hopefully you can hear me okay. So I'm a psychologist, and for some reason I got into doing the financial stuff in my community mental health center. I think it was because I was the only psychologist that wasn't afraid of doing math with dollar signs. And I think that's what qualified me. So they'd say, Andy, go figure out these rates. So I've spent the last 20 years working in Medicaid system, working with state agencies, trying to help weave those funding streams together like Tracy was talking about. And it's wonderful being in foundation land because foundations are very different than that. But the lesson, I think the danger with foundation land is the thing that I saw across those 20 years of working around mental health financing and human service financing is that maybe sometimes the agency leader is interested in maximizing money, but most of the time the agency leaders and certainly the operational staff are interested in the easy money. That's what people want. So when you're trying to convert, and the easy money is the money you have today. The easy money is the stuff that has the fewest strings attached. So when I go in to a provider who's never taken Medicaid before or to an agency and I say, okay, we need you to start doing Medicaid, and we start showing them the Medicaid regulations, and we introduce them to the Medicaid managed care organizations, and we start looking at all that, and they realize, oh, you can only use it for health services and not this other stuff. Their eyes glaze over and they're sort of like, I don't want to do that. And then when we start talking to them about how they can reuse state and county dollars, sort of like the Secretary was talking about, again, the cost effectiveness, the demands on that are so strong that, again, people are like, well, I'm never going to be able to do that. So they often will look to foundations. And so foundations, unfortunately, a lot of times get the rap as like they're the easy money. If we get those foundation dollars, and you know, there are national foundations that are trying to put metrics in place, but even those folks, I mean, you just gotta like do the reporting and you get the money. So it's actually relatively easier than these others. And I think what we're trying to do in Texas is to look at it a different way, because foundations don't like that. They don't like to be seen as the easy money. They don't like to be seen as sort of the pot that's gonna be able to just, you know, fund you for a while and then we'll figure something else out later. So the idea in Texas with the Meadows Foundation, which is the only foundation in Texas that's Texas-based, that gives across all 254 counties of Texas, which is a big deal because a lot of the foundations in Texas give just regionally or just give in a particular part of the state, but also it's a big deal because the Meadows Foundation is pretty well beloved because of that. And so the way I would like you to look at foundation dollars is they are transformational dollars. They're the dollars that you can use to fund things that you can't pay for with Medicaid, that you don't have the cost savings horizon to be able to do a transformation to get the sort of county or state dollars that you want. And if you think about them that way, and that's how we're trying to use them in Texas. So we're trying to pay for things like planning, for bringing people together, for convening, because a lot of times agencies can't use that. I mean, I've been able to pay for a dinner sometimes, and that's all that it takes to get people together. And it's hard, you can't pay for dinner with Medicaid dollars, just in case you're not clear about that. So the transformational piece. So it's not, and the other piece too is I think that we're trying to do is to build it into these sort of regional plans. So again, like you're doing with Dauphin County, to try to take some of our counties in Texas, like Bexar County, Harris County is a little bit harder. I mean, there is a quantity is a quality all of its own. But we're trying to build these multi-year plans where we use the foundation dollars to pay for things that then we're going to backfill savings, because we do think we can get some savings 2, 3, or 4 years out once we get to a certain level. It's not the first 4 people, but if we can shut down a unit, if we can like reduce psychotropic medication use, things like that, we can bring some money back, we think. The other thing, though, that keep in mind with foundations is there is a currency there that foundations are very concerned about their legacy, about their reputation. And so if you have a foundation that is highly respected in your state, like the Meadows Foundation, like the Houston Endowment, like some of our larger health conversion foundations, the nice thing is it's sort of like the good housekeeping seal of approval, is that you're able to get other foundations. And a lot of times it's not just the foundations, it's the philanthropists. Every community in Texas, and we have some really small communities in Texas, so I'm guessing this is true elsewhere, and it certainly has been in the other 20 states I've worked in before I moved to Texas. There's wealthy people, and there's individuals who have mental illness in their family, like Mr. Early was talking about earlier, and those folks a lot of times want to make a difference, but they don't know how. And if you could get a big foundation like the Meadows Foundation or some of your health conversion foundations to endorse something and be at the table, then you can attract other foundation dollars. And we're really trying to do that by going into communities and saying, look, we have this core dollars from the Meadows Foundation, we would like to have your community foundation, these individuals come together. So it's really easy to get, relatively, once you get that momentum going, to get those sort of seed dollars in place. But then the temptation is to treat it like the easy money as opposed to treating it like the transformational money. And I think the other thing too, that if we really get at this, that I'm hoping, is that once we get some momentum going, we can begin to also use it as visionary money, because I think, Mr. Early made the point earlier that, he wouldn't get a variety of health conditions other than mental illness dealt with law enforcement. We're really trying to emphasize that in the state of Texas, and we're saying, okay, we all know that the best known institution in Texas for mental health is the Harris County Jail. When we ask people what the best known governmental institution is in Texas for cancer, people sort of scratch their head. They're like, well, we don't treat cancer through governmental agencies. And then if you let them think a little bit, or if they're in the profession, they realize that MD Anderson, which is a fairly well-known cancer treatment place, I was in San Francisco and I saw an advertisement for MD Anderson. So that tells me that if in San Francisco they're advertising Texas-based agencies, then clearly it's a well-known organization. How do we get the best-known organization in our state for mental illness to be something like that, one of our leading hospitals? And we really need to, I think, have those challenges out there. And that sort of visionary challenge, things like that are what animate foundations. Those are the kinds of things that they want to get behind. And really, frankly, they're the things we should get behind. I mean, it's, I think one thing we all share that we've talked about the last couple of days, and I think what animates this discussion right now, is it's just the ridiculousness, the outrageousness that we would treat an illness like this with law enforcement, that we would do it in our correctional system. And so being able to make that shift is really going to take those sort of transformational dollars, and that's what we're trying to do.
So just quick follow-up question, Dr. Keller. So a lot of these counties in the room here have a health foundation, not necessarily oriented to criminal justice issues, but a health foundation maybe works with a local hospital or children's issues. Now you're talking about adults in jail. Real quickly, what's the 30-second pitch with the first meeting with someone from that local foundation?
Sure. So the foundations, they do have their areas of giving. And so you have to know what it is that they want to give it in. So if they are a health conversion foundation that is trying to, generally they're dealing with some sort of, pushing the boundaries of healthcare delivery, trying to reach marginalized populations. So I mean, basically that's how you have to talk about it. You basically have to say, there are health needs here that are not being met. And so how do we meet those health needs? And you have to trace it to the health need. I mean, they're not going to just want to fund the, getting law enforcement better equipment. That's not going to be, conversely though, there are other foundations out there who do care about public safety, who do care about public policy, and sometimes you have to make the sell to them more by tying this to public safety. So I think you just have to be able to find that thread, and really it comes down to knowing those foundations, which having a foundation partner with you can help you with that. Because they know each other, they go to conferences together, they hang out together. And so being able to talk to the foundations you work with about what do these other foundations care about, not in an effort to like manipulate them or sort of sneak things in, but to really help them live out their mission, because these folks want to help you. And a lot of times there are dollars that go unspent because they don't find somebody that's willing to sort of take that extra step to get outside their bubble and to try to partner with them.
So we just heard about a pitch to a local foundation, recognizing it's not going to be the kind of money that's going to fund services on the scale that's necessary, but on the other hand, crucial gap-filling dollars can get the ball rolling. Also, a lot of these board members of these local foundations, very politically connected, can help expand the kind of support for this overall work. So let me now turn over to Maury Thompson. And Johnson County. We're going to hear later from the Bureau of Justice Assistance and federal grant opportunities. Johnson County, I know, has benefited from that. I also talked to a lot of county commissioners who say, not crazy about federal grants. You get the money, then the federal money goes away. Now I got a position I got to keep funded. So talk to us a little bit about how you've navigated that in Johnson County.
Absolutely. Thank you for that. There, thank you, that'll do. Yes, as we heard here this morning, this is very important, critical work that we've all set about to do. And to be successful, I believe you've got to utilize all of those funding streams that are out there, federal, state, local, and the private philanthropy dollars. And fortunately, I believe we've had some success at that in Johnson County. I trace back the origins of our work to really 2008 when we established our Criminal Justice Advisory Council and hired our first criminal justice coordinator. Having said that, I could go back a little further. We've heard a lot about CIT, and we've been engaged in that work for many, many years, which has been very helpful in Johnson County. But again, really starting in earnest in about 2008, the group came together and quickly identified the intersect of criminal justice and mental health issues as one of the primary issues that they wanted to begin to address. So they began looking out across the landscape about what were the funding opportunities and quickly identified justice and mental health collaboration dollars. We were fortunate to apply for those and obtain those in 2010 and I believe 2013, which funded a co-responder program, the embedding of a mental health professional in a local police department. Bit of context, in Johnson County, a county of about 575,000 people, we have 20 municipalities in the county, so lots of different police forces to deal with there, as well as our county sheriff. So again, we partnered with our largest two municipalities, and the second largest was the first out of the chute. They received funding for one co-responder. Shortly thereafter, our first largest city came on board with one as well. I think this is one of the great examples, the one that I like to use, the ideal scenario when you receive grant funding. At the conclusion of the grant, the city came to us and said, we cannot lose this valuable resource. Again, we heard this morning about the dollars and cents of the issue. We've seen the data, we've seen the savings, we've got to do this, we're going to fund it ourselves. So great success. Second city, same thing. Came to the end of the trial period, the data was so compelling, they said, we will fund this full cost. Provide us the staff, pick up the cost. They quickly then said, and we need a second one, by the way, and we'll fund that. The other cities began to see the success, see the data. We've got our next two largest cities are now partnering, and we're in the process of hiring a co-responder for them. No grant funds were available. They looked at the data from the other two and said, we really don't care at this point whether they're grant dollars or not. This makes financial sense for us. We'll split the cost and hire one. Now we've got a consortium of the smaller cities in the northeast part of the county saying, we need in on this too. What about building a model that we come together and fund one there? So again, just the ideal response that you want to see, the grant dollars coming in to demonstrate success, and the city seeing that and funding those on an ongoing basis. So that's a little bit about the federal piece. Again, we heard it's really important to engage your state partners as well, and we've had some success there as well. We have a 24-hour assessment, triage, crisis observation, short-term crisis stabilization, and sobering bed unit. That's a partnership with Johnson County, Wyandotte County, our county to the north, and our local alcohol and drug treatment provider. The state has seen the value in that effort as a way to reduce admissions to the state hospital, and they're funding that about $3.4 million a year, solely state funded, because again, they've seen the value to them. Not only, as we've heard, is it the right thing to do, but it makes financial sense. We've been a little nervous about that, though, quite frankly, because of budget problems in Kansas and whether there would be a continuing commitment for the state. Within the last couple of weeks, we've been given a guarantee of funding now through June 30th of 2019, the next biennial budget. So very pleased with that as well. Another example of state funding is some behavioral grant funding coming from the Department of Corrections now that we are using to hire mental health staff to go into our community corrections facilities and provide evaluations there. And again, that's completely state funded as well. We in Johnson County, again, a little bit of context, the Mental Health Center is a department of county government. So very fortunate for us in that corrections and the Mental Health Center are both departments of county government. So we have a wonderful collaborative working relationship there, which has been able to produce some efficiencies for us as well. So that's going well.
A quick question for you,
Yeah.
Mr. Thompson.
Yeah.
You mentioned that when the grant wound down, the
Yes.
city stepped forward, looked at the data, said this is something we want to continue. What advice would you have when you look back on it? You know, was it just all the stars kind of aligning, or were there some things that you did early on that you think really put you on that runway so when it wound down, they were ready to make that investment? Because oftentimes, budgets don't move fast. That grant's headed south. The budget process takes a year to put together. How did it all, what advice would you have to local governments out here to really make sure things are on track so that there's a seamless continuation?
Yeah, my advice is, and very timely question, we're reminding of ourselves of this right now as we start out on a new initiative. It's very important to establish the benchmarks before you get started. Determine what success will look like so everyone has a clear set of expectations going forward. So again, you can clearly demonstrate we did what we said we were going to do, we were successful or not.
So in this case, the county got the grant, but the city knew what success was defined as, and when they saw that, that's when they picked up the cost.
Absolutely. One other funding piece that we haven't talked about here that I want to make sure that I mention, when you begin to look at cost savings, there are two other entities that we've identified that are sharing in this cost savings, and that's our local hospitals, the diversions from the emergency departments, and then also we're a Medicaid managed care state, so our MCOs are seeing savings when we do that too. So we're now beginning to engage our local hospitals, bringing them to the table to talk about, hey, you've got some savings here. We need to talk about you bringing some dollars to the table to help continuing to fund this work. Likewise with our managed care organizations, and I've been pleasantly surprised there's some interest from them in talking about this. Again, in Johnson County, where fortunately I talked about corrections and mental health, our emergency medical services, ambulance service is also a county department. So we control that data as well. That's been very intriguing to the managed care organizations. I've got case managers now receiving, within 24 hours, notice of any transport to a local hospital. We're able to very quickly identify those people accessing EDs and get a case manager to them, which drives that metric of keeping them from returning to the ED within 7 days, which they're all measuring very closely. So again, that's another area of funding that I'd encourage you to.
It's a great area to
pursue.
look into. One other question I just want to turn back to you, Director Plouck. Packaging the ask. I know when people talk about the service needs, it's so overwhelming, right? I mean, you hear like a need that you can't even imagine. We need, let me tell you about all the cuts the system has gone through, right? The hundreds of millions of dollars. And you have to go now and you got to make an ask. And the judges love beds, right? They want treatment beds, right? You hear about, we've heard about supportive housing units. We've heard about peer supports. Do you just throw it all on the table and kind of see what sticks? I mean, what is a practical ask to make when you're actually talking to these state health offices?
Yeah, I think there's nothing more off-putting to a potential funder than mental health folks flopping around in a pit of inertia that we need more money. I think you have to be very, you have to be very specific, not only with what you want, but what you're going to deliver with these resources. And so I mentioned that we have the grants with some communities. Each one, while it was a local proposal, they all look a little bit different. Each one has measures that were articulated in advance. They report quarterly on their progress. And we know that in some communities, they've actually served more people in the jail with these dollars by December than they thought they would serve by June. And so they came back and said, hey, can we have a little more money? Sure, here's some more resource. So I think being able to measure and being able to, use that to make the case beforehand and then come back and close the loop is extremely important. And it's compelling because people aren't used to hearing mental health folks talk in those terms.
And just again, I've seen it too. It's hard to get people in that place. What happens when, you're the county commissioner? That's the response you want from your mental health system, but it's just not coming together. What's the next move? What's the follow-up?
Well, in some communities, I mean, the commissioners have direct input into the financing of the local mental health system. And so, I think that if this is a priority for the community, this is a priority for the commissioners, I mean, that needs to be part of the discussion, quite honestly.
That's when it goes to hardball, it sounds like. Okay. Any closing comments before we wind this panel down? Anything, Dr. Keller, anything you wanted to add quickly?
Well, I might just add that the other thing I think you can use philanthropy and foundation dollars before is to engage government officials. So I think a lot of times, like the mental health center director, if they're not inclined, sometimes you can, the sweetener of having the foundation dollars can help with that. If the county is not inclined, a lot of times these are folks that have influence in your community, so you can get an audience with people and you can get people to listen. And then even with our state legislature, we found that the idea of being able to design sort of local state match sort of ideas was a way in times when people were not inclined to just throw money at mental health, which is pretty much all the time. That they were willing to say, oh, hey, we are interested in doing those sort of collaborative things. So I think a lot of times you can use it in partnership with other funding streams to leverage those other funding streams.
Terrific. So hopefully you all found this with some actual practical, concrete steps we can take back to counties across the country. Before we thank our panel, I want to turn your attention to what we're going to do next, because we need to stay in here, which is a half hour more, but it's very important what you're going to hear next, because you're going to hear from the American Psychiatric Association Foundation about what's next for stepping up, and then perhaps of most interest, hear from the Bureau of Justice Assistance and funding opportunities that they currently have available, as well as other kinds of support BJA is looking to provide the field. So I'm going to ask them to come up, but as they come up, please join me in thanking our terrific panel right here. So I'm going to ask Paul Burke to come up to the stage, who's, again, the director of the American Psychiatric